Hello everyone, this is Dr. Murali Mohan. I am the Senior Consultant Pediatrician and Neonatologist at Joshna Hospital, which is located on TC Palya Main Road, Bangalore. Today I am here to discuss or enlighten few reasons why your kids or your children need a regular OPD visits or at frequent intervals. If you see, many of the parents would be worried about their children general health or well-being, or whether they have any infection. These are the very common reasons the parents get their children to the hospital for a pediatrician visit. If we go by system wise, and if we separate the reasons into two groups, one could be the infection part and other could be the non-infection part. If you think of infections, the very common reasons why parents get their kids to hospitals is fever. The first symptom the parents would be worried is fever, and most of the infection are related to respiratory system, like breathing related issues along with fever. And if we say respiratory system, it will start from nose and it will end in lungs. And the very common infection from the nose is common cold, but few kids needs to be seen in the OPDs even with common cold to assess their general well-being even with a very common cold. And if the common cold also lasts longer than 5 to 7 days, you need a hospital visit. And the next reasons would be like you can have a pharyngitis, which is a throat infection, or a tonsillitis, or a pneumonia which is already spread to the lungs, which can be a viral or bacterial, because pneumonia can be a serious illness where the children has to be hospitalized. And at this point of time, OPD visits are required because the general well-being of the child to be assessed, and the clinical assessment based on that whether the kid requires hospitalization. And if you say other infections, like it can be whatever I told you till now, like acute infections, they come just like that. And in case the child is already having some underlying lung illnesses, a child in case of asthma, regular wheezing children, or some amount of some kind of congenital lung lesions, these are the kids we need to be much more watchful for them, because even a small infection can result in a major morbidities or mortalities in children who are having underlying lung illnesses. And if you go to the next system, which would be gastrointestinal tract, which starts from mouth to the stomach and then which continues till intestines. And because nowadays many of the kids are used to eat outside food than home food, preferably they will be preferring the junks, fast foods and all. And because of this, they will have the infections related to the stomach and intestines, and the most common would be a diarrhea. And majority of them, the diarrhea would be viral and it will be a self-limiting. But even it's a simple viral diarrhea, we would be more worried about the kids' hydration status. For that reason, we should have a OPD visit for children even if it's a simple viral diarrhea, because in case if the dehydration is severe, the child may need hospitalization, IV fluids and further monitoring. And these kind of viral diarrheas with dehydration we see more in younger children. But if you go to little elder children or older children, they can have dysentery kind of episodes because of food poisonings. And other thing, if you come to the long course of illnesses in terms of GI, there could be a colitis which will be related to the intestines, or it can be a appendicitis also, because some children along with fever they present with pain abdomen, and it can be amoebiasis also if you have a regular habit of eating outside. And it can be a typhoid fever which can present as a gastrointestinal symptom, because many kids love ice creams and cakes, and which will be the common reason for typhoid fever, and preferably if the child has not been vaccinated against typhoid fever. And the next most common infection related visit to our OPD visits will be skin infections. And the most common skin infections in children are again viral only. These can be a measles, where the child present with a red rash all over the body. It can be a varicella, generally termed as chicken pox, or it can be a hand, foot, mouth disease, which is much more prevalent these days. Like it looks like a chicken pox, but there will be little subtle differences between chicken pox and hand, foot, mouth disease, but still they can have a similar presentation, and the course of illness also will be the same. But they need a hospital visit, because it's not because of the rash, it can be because of the disease itself. Even a measles, child with measles, varicella or hand foot mouth disease can be sick because of the associated other symptoms, or because these are all viral illnesses. During any viral illness, the kid's immune level drops and they can land in secondary infections which may warrant hospitalization in these kind of kids. And the other common skin related infections could be a simple impetigo, pyoderma. But even if these pyoderma or impetigo are not treated properly or timely, it can lead to a cellulitis. From the skin, it can spread to the soft tissues like muscles, and it can lead to cellulitis and abscess. And that is the place where the child may require hospitalization and higher kind of antibiotics. And coming to the next system would be the bone and joints. These infections mainly we see in little younger children. It can be a septic arthritis, which we commonly see in newborns, and osteomyelitis. This also we see in younger children. And the rarest would be the brain infections, which is called like a meningitis and encephalitis. But these are also seen very rarely in bigger children because of their strong immune status. But it can be very common in younger children or younger babies like less than 1 year, where their immune system is little is in the growing stage or developing stage, and they can be at more risk of generalized infections. And of this brain infection, what we call as meningitis or encephalitis, could be severe. In these regions, if any child having a fever or infection related symptoms which are having a little prolonged course, the child well-being is not good, obviously you need to visit the hospital and to have a check with your pediatrician.